Thank you so much for coming, Amy. Right, so the first question that I'd like to ask you is, what led you to become a doctor? And in particular, why a GP?
So I'm going to age myself here. I was a huge fan of St Elsewhere and Doogie Howser as a young child, and obsessed with all things medical on TV. And then my aunt, who I was very close to, was a doctor working at UNESCO in Paris, and used to tell me all the stories about the patients she would see all around the world, where they came from, all the things that she came across. And I just found it really fascinating. I think inherently I'm quite a nosy person, and that kind of helps when you're a doctor. So I was 8 when I decided I was going to do medicine, and I at med school I went on to obviously do all my various rotations, and every single rotation I did, I was like, oh, I love this. I'm going to be a pediatrician, or I'm going to be a psychiatrist, or I'm going to be a surgeon, and really enjoyed all aspects. So that in part really sort of contributed to just that I just like all aspects of medicine, and that's where general practice is brilliant. And I think what I discovered is the more practice I did in it at medical school was the continuity of care, getting to know your patients, getting to know their families, getting to know their backgrounds, and being part of a bigger network, and helping them. So that's kind of what led to me going into general practice.
Brilliant. That's really interesting and amazing to think that you wanted to do it from such a young age. That's really cool. Right. So our next question is, how did COVID-19, I mean, COVID-19 affected all of us, didn't it? So much, but how did it particularly impact on you and your role as a GP?
So, and I think it was, when you think back to sort of March, well, even earlier, January, February, you sort of heard this thing looming in the background. There was something coming, but you didn't quite know what was going to happen. And then when we saw the events unfolding in Italy, particularly, knowing how close to home that was, I think we began to really get scared, frankly, in medicine and in general practice. And as I was working in a practice in East Lothian, we overnight changed the way in which we did things. Once the information came in about how we had to change stuff, we overnight revolutionized. We went from patients booking appointments face to face to having to do everything over the phone. And those first few days and weeks were really overwhelming. But my time as a GP in the pandemic was quite relatively short, because I became sick early on. I got sick in mid-April, and that meant that I was taken out of the workforce, and of course felt quite guilty about that.
Yeah, I imagine that was really, really difficult. And that leads into my next question, which is, can you tell us a bit about your experience of realizing that you had long COVID and sort of the impact that that had on yourself, and also I imagine on your family as well?
Yeah, I got sick on April 11th. Sort of came on quite insidiously, had a bit of fever and a bit of headache, wasn't quite what I was expecting. But the day after I was ill, my husband got ill, and the 2 days after that, our children, who were 3 and 5, got ill as well. So I think there was the initial fear aspect, just sitting at home. You're not able to seek help, but you're told you have to stay at home. We were quite ill, with our oxygen levels dropping quite low. In any other era, a 39-year-old with oxygen saturations of 88% would have been in hospital, but we didn't. We stayed at home. And I think those early days were very much just struggling to just get through every day, having to look after young children who were ill for about half an hour, and then both of us being ill was quite challenging. And so essentially Disney Plus became the surrogate parents, and we made sandwiches when we could, and we got out of bed when we could. But it was very different to what we had been doing up until that point, with our daily exercise, etc. And I just didn't get better. 2 weeks in, my fever was going up rather than down. I was seen up at the COVID assessment centre, and they said, yeah, there's nothing much going on with you. Have some antibiotics if you want, and off you go. 3 weeks in, I was seen because I was really breathless. I'd sat at home with a high respiratory rate of 30 all day, and I was beginning to panic about blood clots and things like that, because I'd been reading about how people with COVID might get blood clots. So I was seen up at the hospital and checked out for that, and sent away and said, everything's fine, just go home and rest, which is laughable when you have a 3 and a 5-year-old. Then a month in, I still hadn't had a fever-free day. I still felt dreadful, fatigued, breathless, all the rest of it. I remember trying to brush my kids' teeth, and I had to hold one hand with the other, because I just didn't have the energy to do that in someone who was previously running 5 kilometers several times a week just to keep fit and healthy. So I emailed an infectious diseases colleague and said, if I leave the house because I wanted to get outside in the fresh air, am I going to be Typhoid Mary and infect everyone around me? Or am I still contagious? And he said, oh, you're not contagious, but we need to see you, because it's not normal for someone to still have fever after 4 weeks. And that's the weird thing about all of this being COVID. You didn't see your doctor, you didn't go anywhere, you didn't do anything because you were told to stay at home and you didn't want to bother anyone. So if, my GP referred me up, and I got seen a couple of weeks later, and they did all sorts of wonderful tests and more swabs and all sorts of things, and said, look, we can't sort of see anything wrong. We're hearing about people like you. You're the first one that still has fever, but we don't really know what to do with you. We'll call you in 3 months and see how you are. So that was that. Left to it. Off you go. My husband also has long COVID. So the two of us just kind of struggled every day to just kind of, keep going and keep the kids happy and entertained and fed and all the rest of it. As things progressed, every day, ongoing symptoms. 3 months in, I thought, gosh, I must get back to work. I feel really guilty. I need to get back to work. I need to help my colleagues. I need to, maybe it's all in my head. Maybe if I go back to work, I'll be fine, And so I did a spoke with my colleagues, and we thought, well, I'll do a half day of paperwork and then a half day of seeing patients. And that led to a massive relapse. And that was the first time that I really appreciated that cognitive fatigue could cause physical fatigue. And that landed me in bed for 10 days. I could hardly speak. It was too fatiguing to use my mouth. I could hardly eat cereal because my jaw hurt too much. I could hardly lift my hand to my mouth to drink because I was just so incredibly exhausted. And exhausted is not even the right word. It's really hard to put into words what that feels like. And it then made me realize that this was going to go on. This wasn't going away. I was terrified I was going to get ME, or chronic fatigue syndrome, and be bedbound. I just really at that point realized that there was a lot more to this. And so over the summer, I started to seek alternative sources of help. So I would see a nutritionist, I saw an osteopath. I sort of tried to do anything I could to feel better, really. And as time progressed, I eventually got a diagnosis of POT syndrome, which is a consequence of COVID, and was started on some medication. And that made me an awful lot better. So I went from having lost my job as a GP because I was off sick for too long to then able to locum and get back to work after that time. So those sort of 7 months were quite harrowing, and a real eye-opener to what chronic disease can do to someone, and how you can go from, a very stable, happy family life to things looking pretty bleak, and the future very insecure.
It's crazy, isn't it? I mean, it's crazy to think what could happen in such a short space of time, and the impact. I mean, you've touched on these already, Amy, but what do you see as the main sort of challenges for people with long COVID?
I mean, I think this is the one thing is the not knowing. It's not knowing what the future holds. It's not knowing what you're going to be able to do, what you're capable of doing. Are you ever going to be able to work again? Are you going to be able to pay your mortgage? Are you going to lose your house? Are you going to lose your livelihood? When is it going to get better? Who I'm seeing, what do they know about my illness? It's a new thing. Can they help me? Can I get medication? There's so many unknowns in all of this, particularly because it's a new illness. And I think just lack of knowledge and understanding about it. So I think it's just understanding that someone's life has turned completely upside down, and your friends and family don't understand. Friends don't understand. Or, well, why can't you come for a cup of tea? You've not done anything today. Or that sort of, why can't or why can't you speak on the phone for that long? That's a bit odd that you're too tired to talk on the phone. And people don't say that, but you know that they're feeling that. And I remember even my mother, bless her, at some point, the whole sort of trauma, the thing, and she said to me sort of, well, isn't it time you moved on? And I think that was meant it was meant supportively, but actually
That's really hard, isn't it?
it's
Really
really hard to to move forward, especially when it's so overwhelming, so encompassing of every aspect of your life.
Yeah, no, I think it's crazy. And I think it's hard because sort of the British culture, stay calm, carry on, that's what everyone's brought up to do, isn't it? And the advice for this is completely different. So what do you think the value of tailored information for people with long COVID is then, Amy?
So I think in particular, there's understandably a lot of lack of knowledge around long COVID in general sort of medical circles. You know, people are so busy. You know, we're desperately in general practice treading water, desperately trying to make ends meet on a daily basis, trying to meet the needs of our patients. Doctors are working very long days. They haven't then got the time to go away and read about stuff. And the problem is there isn't also any sort of central knowledge because it's a new illness. We're getting bits and pieces from different directions, but there's no, you know, nice guidance is helpful in a certain way in that it provides a sort of a framework for what long COVID is, but it doesn't really give you much information about what you do. So what tailored talks and what tailored information can do is allow the GP to provide information to a patient that's specific to their needs. So let's say I've got problems with breathlessness, and I'm feeling exhausted. I can get now a slideshow that will tell me what things I can do to help my breathlessness, what I can do to help my fatigue, how I can pace. And that enables the GP to pass on information. When the GP's only got 10 minutes, actually they can then hand on a whole wad of information that the patient can take in bite-sized chunks. They can read it when they have the cognitive ability, because that's the other problem is you'll go and see your GP and it might not be a good moment. And they might offload information to you, but actually you're too tired because it took all your energy to get to the GP or summon up the energy to phone them. So actually it's information that tailored information that you can use at a time that suits you and your body and your brain. And also information that we have collectively gathered across our networks that we have learned from other people as to what helps people with, in this case, long COVID, but also can be used for other conditions.
Yeah, that's brilliant. And it makes a lot of sense, doesn't it? So what led you to take on the role as clinical advisor for Chest, Heart and Stroke Scotland?
With all these things, you fall into it, don't you? So I had, with a group of doctors in Scotland, contacted the former Cabinet Secretary for Health, Jean Freeman, back in December 2020, lobbying for better care for patients with long COVID. We recognised that there was a huge hole in care for patients with long COVID. And I was invited to a meeting alongside the CEO and directors at Chest, Heart, Stroke Scotland to discuss their proposals for a long COVID helpline. So they support patients via an advice line for people suffering with long COVID. And at that point we met and we discussed, and they took me on as a consultant for them so I could provide some information that I'd gathered through networks. And then eventually they offered me the role as clinical advisor for the charity. It's their first one. They've not had one before, but it meant that I could help influence care for patients and for colleagues and staff across all the conditions that Chest, Heart, Stroke manage.
Brilliant, brilliant. I mean, it just sounds like such an important role. So, and of course, it was that role that brought you to work with our team here at Pogo Studio, NHS Lothian, Chest, Heart and Stroke Scotland, to develop the MyTailoredTalk app. How is this going to help people with long COVID, Amy?
So our initial project that we're doing with NHS Lothian at the moment is where a patient will go and see their GP and say that they're struggling with things like breathlessness and fatigue. And the GP can then refer them into the service where they will be invited to download an app on a tablet, laptop, phone, where they will then be asked to answer a series of questions about the things that they're struggling with. And then on that basis, they will be asked if they wish to have further information on the aspects they're struggling with most. So let's say that was breathlessness. They would then be invited to download a tailored talk all about breathlessness. And then from that point, they're then offered one-to-one support with an advice line nurse from Chest, Heart, Stroke that lasts for probably up to about 12 weeks. And that means that patients can then have ongoing support as well as the tailored talks from a human being. So they're sort of working together. I think it's important to say there's only so much we can manage. So we're focusing mostly on breathlessness, fatigue management and pacing. Those are the things that we can manage, and I think that's one thing that we just need to be aware of. Long COVID is complex, but these are the things that we can do, and we can do well and help patients with that.
That's brilliant. It's really, really exciting project to be involved in. So, Amy, what are your hopes for 2022?
I'll get rid of COVID.
I know, I think we've all
I think that's optimistic though, sadly, with the way things
What are your realistic hopes for 2022?
My realistic hopes. Oh gosh, I just hope that people, particularly living with long COVID, can get better care. I've been lobbying for a long time for Scottish Government to provide long COVID clinics, or a version of. I know long COVID clinics are a dirty word in Scotland, but essentially multidisciplinary care for patients living with long COVID. I'm really hoping that we can use that synergistically with this sort of technology. This technology is part of a bigger piece of a puzzle, and that's certainly something that Jean Freeman said to us, when we met with her, that this is a great project and it's great what we're doing, but it has to be part of a bigger picture. And I think the issues that we have in Scotland always are things like rurality. Whatever works for Barry and in Bathgate needs to work for Barry and Barra. And it's just trying to make sure that people get the best care that they deserve. And I just constantly raising awareness to make sure, and also not to forget, the children that are involved in this. Children have long COVID too, and making sure that they are also seen and their voice is heard in all of this. So yeah, not a big ask.
Just small ambitions. Brilliant. And lastly, if there are people in this audience who want to know where to go to for support, if they think they've got long COVID or they know someone with long COVID, where would you recommend they go?
Yeah. So I would definitely go and see your GP, and I think in a lot of this, particularly those that got sick in the first wave, perhaps have lost a bit of a relationship with their GP. I think, there was a lot of misunderstanding at the beginning. And I think there was also a lot of people just, as I said, staying at home, coping on their own. And I think we need to re-engage. If you're not seeing your GP doesn't know that you're not well. Your GP assumes that you are fine unless you're contacting them. And I think that's the thing that you've got to keep going back. So I will always say that your GP is your first port of call. That said, there's really helpful information on the Chest Heart Stroke webpage. So there is information there. There are information leaflets. The advice line is open to all, so you don't need to be referred from your GP. The advice line is written on the top of the webpage. You can just go, you can call. As I said, they will focus on breathlessness, fatigue management and pacing. And if you're having more complex issues, that you do need to go back to your GP for. That said, they can help you to advocate. They can help you to advocate for yourself. So it's something you're struggling with. You feel like you've been to your GP and you're not getting anywhere and you don't know what to say. Again, there are people there that can help you with how to do that. And also peer support. Peer support's so important. Whether that's through Chest Heart Stroke Scotland peer support groups, whether it's through Facebook groups, whether it's through, anyone that you can find that is living with what you are living, then those are the only people who truly understand you. And they will also have read and talked to other people and you can learn more. So those would be, and also, of course, Long COVID Scotland, the charities, not the charity, but the group is really important. And Long COVID Kids for anyone who has children. Those would be my main ports of calls, but there will be many others that will pop out of the woodworks as well.
No, that's brilliant. Thank you so much, Amy. Right, unfortunately, we don't have very much time left. So I just wanted to let you all know that on the 26th of April, our next Health Tech Talk will be by Dr. Lucy Skies, and she's going to be talking about the trials and tribulations of testing healthcare products within a clinical setting. So that, again, should be a really, really interesting talk. So hopefully we will see lots of you there. If anyone has got questions that you would like to pass on to myself or Amy, if you can email through the info@pogostudio.com email address that's in the chat, then we will definitely come back to you and we'll be able to respond. But thank you so much, everyone, for your time. Hopefully this has been interesting for you. I know that I found it really interesting. Thank you so much, Amy, for coming to speak to us. And hopefully we'll see some of you again in April. Okay, thank you then.
Thanks.